everyone, welcome to Health Monitor. This is the body care segment on Health Monitor. I'm your ever faithful host, Joan Uluge. Today we're going to be talking about CKD, chronic kidney disease. We're going to be exploring different facets of chronic kidney disease. And I know it sounds like terror, but take it from me. You should actually sit in, listen in, because this health information is very valuable to you and yours. I'm not a health practitioner, but I do have a health practitioner in the studio today. She's a beautiful nurse. We're going to go on a quick short break, and when we come back, she's going to introduce herself and we're going to go straight into understanding what CKD is. This is the body care segment on Health Monitor. We'll be right back. Don't go anywhere.
Health Monitor, yeah. Your guide to good health. It's Health Monitor, number one health survey.
Hi everyone, welcome back. This is still the body care segment on Health Monitor. And before we went on a short break, I did mention that I have a beautiful nurse today with us, and she's going to be telling us more about chronic kidney disease, also known as CKD. So whenever you hear me say CKD, it stands for chronic kidney disease. I'm not going to talk any further. The floor is yours. But first of all, would like to thank you for making time out to be with us today. We are so glad and we relish your presence. You look so beautiful. So the floor is yours. Please introduce yourself.
Thank you for having me here once again. It's a pleasure to be here. Olawoore Victoria. I'm a registered nurse, a registered public health nurse. I'm a public health advocate. I'm passionate about individuals knowing what to do about their health, how to know pointers that danger signs and when to run to the hospital as soon as possible. I also educate people on diets. You eat well, you live well. Thank you for having me once again.
Thank you so much. It's a pleasure. Nurse Victoria.
Yeah.
Okay, so let's go straight into this. Guys, trust me, you want to listen in on this. Don't go anywhere. Let's understand what CKD is. Okay, so quick summary. What actually is CKD?
So CKD is chronic kidney disease, and it's a disease that affects the kidney. Basically, the kidney undergo a lot of things. It's perform various functions, and the kidney is like a somewhat filter system. So it helps to excrete body waste. It helps to it helps to control blood pressure. It helps to balance the body fluid in our body. It helps to balance the electrolytes. How should they be? How high, how low they should be in the body. So it helps in different things. Activation of vitamin D, which helps with our bone. Yeah. So all of these are the functions of the kidney and more. But sometimes when CKD happens, it just comes, and what it does basically that the kidney loses its function.
Wow.
Yeah, that's just loss of function of the kidney and can ultimately end the kidney. Can lead to ultimate loss of function. Like it's a gradual loss of function initially, but over time, if it's not well managed, the kidney can shut down.
So speaking of now we understand what the kidney does. Now we understand what CKD is. When the kidney doesn't function well, the opposite of that is chronic kidney disease.
Yes.
Now, what are the quick symptoms? Like, how can somebody realize, as a layman, I'm not a practitioner, but how can I tell that, okay, yeah, I might have, God forbid, not me, or a person might have CKD?
Yeah. So one thing that is quite paramount is nausea and vomiting. A lot. Like it's quite on the high side for CKD patients, nausea and vomiting, loss of appetite, weight loss. But sometimes people don't lose weight. Some can be weight gain because there's something that happens, swelling. So their body becomes puffy, the hands, the body, the feet, the ankles. So you see the swelling. Even under the eye, you see that the eyes are puffed, they are big. Even though maybe you can tell that the person is bloated. You can see the person like, what is happening? Once you press their skin, it goes down and takes a lot of time to come back. So it's a danger when you see that you are getting puffy of some sort. Yes, it's a pointer to CKD, weight loss. Like I said, muscle wasting, the person is easily fatigued, cannot do anything. So these are a few signs and symptoms. Sometimes it's impaired sleep. Yes, insomnia. CKD, people find very difficult to sleep because of the electrolyte imbalance in their body. So there's insomnia happening, there are muscle cramps. Yes, muscle cramps, incessant muscle cramps can be a pointer to chronic kidney disease.
I'm guessing that's where vitamin D comes into play. So now CKD, lack of vitamin D, your muscles are in trouble.
Yes.
Wow. Okay, so now, who is most at risk for developing CKD?
So for development of CKD, I think the number one on the charts, diabetes patients. So people living with diabetes, they need to be very careful to monitor their blood sugar closely so that they don't end up having chronic kidney disease.
Yeah.
Also hypertensive patients with high blood pressure, uncontrolled high blood pressure.
Uncontrolled.
Yes. So if you are using your drugs well, doing the things that you should do, you should not end up with this. But many times, Nigerians don't use their drug. They are not compliant with drug regimen. Some use once a week, a drug that should be using every day. Some say God has healed them. I believe so, but use your drugs. Use your drugs. So recurrent kidney infections, yes, those are causes of CKD. Also smoking. I think everybody in Lagos now smokes something. At least. Wait, some people say it's sweet weed or sweet smell. Either which way, smoking is bad for you and can predispose you to chronic kidney disease. Use of tobacco products and the likes.
Wow.
They will greatly damage the kidney. Yes, they do. Obesity. I think the modern day Nigerians are no longer doing anything from work to Uber. Some don't even work out in the morning. And people are just getting very big. The BMI is quite on the high side.
Wow.
So obese patients can come down with chronic kidney disease. So it's very important that you check your weight. If you are getting too big, it's not a good thing. Slow down. Diet, exercise, because obesity is a major pointer to chronic kidney
Can
disease.
kids have, because I'm seeing a lot of obese
kids? I think
now.
that parents need to be very careful with their children.
Yeah.
It's good to give them a good life that you didn't have, but
Yeah.
there are I think there should be restrictions and there
Yes.
should be borderline to these things. You
Yes.
see a child of 10 years old, they are wondering, 10 years old, they are this big, and your parent, I think these are things that can damage the death of that child. I had a patient one time, very big, and it affected her breathing. This child could not breathe without oxygen because the fat was too much. And she'll be needing surgery because the parents were quite negligent about their child's health. So, whatever you are giving your child, ensure that their meals are healthy. Reduce the fats in the food. Healthy proteins are very okay. Yes. So you don't even want to have a child that will be a problem to you in the long run because of your actions. Yeah, family history too. People that have family history of chronic kidney disease in the past, maybe grandfather, father, even uncles, you have to check it. If you have a relative that has chronic kidney disease, it may also be in the gene for the person too, yeah? So frequent use of over-the-counter medication, it's a challenge in Nigeria. I understand that healthcare in Nigeria is quite expensive now. So people don't want to show up in the hospital because you have to run different tests. You feel like, I just have a headache. They'll tell me to do 1 million tests for ordinary headache. But I think it's safe for you. Over-the-counter drugs that are not well used, or you don't use them in the right prescription.
Like people abuse analgesics.
Yes. That's where I'm going to. NSAIDs, especially non-steroidal anti-inflammatory drugs. So abusing analgesics like that will impair the health of your kidney. So you don't want to do that to yourself. So once you can't even afford to be using them over and over again. Some of them you have to come to the hospital, so you know which one will be the safer one for you at that period in time. So use of those drugs, over-the-counter medicine, can also predispose one to having chronic kidney disease, also autoimmune disease like lupus.
Wow.
Yes.
Wow. Okay, so let's talk about like early detection. How regularly should people just go out of their way to test for CKD?
Okay. So like I said, the people that, it's not everybody that we in life have CKD, but like I mentioned, those that are at risk should at least show up once or twice in a year in the hospital to run some tests. There are blood tests that you do, there are urine tests that you will do to check if your kidney is already getting damaged. And many a times, chronic kidney disease is a very fast process. Before you know it, people show up late in the hospital. You ask them for how long, they'll be like, it's just last month and you're already this bad. And sometimes the process is quite irreversible. Sometimes things are already getting very bad before they show up. So once you know that you have these risk factors, show up, do routine checks, at least twice a year, it's enough. You will know where you stand. If you come to our place and we see some pointers, we can tell you that, oh, you came this week, I think you'll have to come back next month again. So I will follow up on this particular range.
Yeah. Wow. So guys, you see why I say you shouldn't go anywhere? So if you indulge in certain lifestyle habits that aren't good for you, that Nurse Victoria just highlighted, I feel you should really listen to her, get to the hospital, get your routine checkup done, even if it's once or twice.
Yeah.
Early detection.
Yes, it's very important. Early detection is very important in management of chronic kidney disease, because if you show up at a stage of, let's say, we have about 5 stages of chronic kidney disease. If you show up at stage 4, now we can tell that it will not get so bad to the place where you will need a kidney transplant. If you show up early, but if you come at stage 5, what are we going to do? Things are already bad. Now you have to be on a donor list or so, have to do a lot of dialysis a week, sometimes twice a week, sometimes thrice a week, because things are already bad.
Wow. And we do know that a famous what's it called? Famous video TG Omori. Yeah, quite a famous gentleman, and he did suffer chronic kidney disease. Although I don't know his health status as at now.
I think a few weeks ago he was, TG Omori is a rich man. Yeah, he's at least he can afford the basic life. Yes, and he made a post on Twitter. I think it's 2 weeks or a few weeks ago that the amount he spent is quite exorbitant on his health.
But let's talk about the fact that when they did the kidney transplants, his body rejected the kidney.
Yes. So now the thing is that even after because before you do a kidney transplant, there will be checks on you and the donor as well. And many a times, sometimes it's autoimmune. You don't even know why. If you have seen a perfect kidney that fits directly into a man's body and it enters, the body rejects it.
Why?
We don't know.
Hey.
Because and that's a lot of money.
Yes.
Now it has wasted. You can't take it back to wherever you took it from.
So you can't return the kidney and put it back in the donor?
I don't think so.